In a child with no pulse and gasping breaths, what should be done first? A. Begin rescue breathing. B. Check the airway. C. Begin CPR. D. Give a shock with the AED. Answer: C. If a child has no pulse and is only gasping, CPR should be initiated immediately. When using a bag mask device during two rescuer CPR, what is the role of the rescuer providing ventilations? A. Squeeze the bag every 10 seconds. B. Hold the mask in place with one hand. C. Open the airway using a jaw thrust. D. Ventilate the patient every 2 seconds. Answer: C. The rescuer providing ventilation should maintain an open airway by using the jaw thrust technique and deliver breaths. During high-quality CPR, what is the maximum time for interruptions in chest compressions? A. 5 seconds. B. 10 seconds. C. 15 seconds. D. 20 seconds. Answer: B. Interruptions in chest compressions should be minimized to less than 10 seconds to maintain blood flow to vital organs. When should defibrillation be performed during CPR if an AED is available? A. After 10 cycles of compressions. B. Immediately after attaching the pads. C. Only after 5 minutes of compressions. D. After giving 3 ventilations. Answer: B. Once the AED pads are attached and the device is turned on, defibrillation should be performed as soon as a shockable rhythm is detected. If an adult victim is found unresponsive and not breathing, what is the correct first step? A. Administer rescue breaths. B. Begin chest compressions. C. Activate the emergency response system. D. Check for a pulse. Answer: C. First step is to activate the emergency response system to ensure help is on the way before beginning CPR. In two rescuer adult CPR, how often should rescuers switch roles to prevent fatigue? A. Every 5 minutes. B. Every 30 compressions. C. After each breath. D. Every 2 minutes. Answer: D. Rescuers should switch every 2 minutes to prevent fatigue and maintain the quality of chest compressions. What is the recommended hand placement for chest compressions in an adult during CPR? A. On the upper half of the sternum. B. On the lower half of the sternum. C. On the abdomen. D. On the left side of the chest. Answer: B. Hands should be placed on the lower half of the sternum to ensure effective chest compressions. How should a rescuer deliver ventilations when an advanced airway is in place during CPR? A. 1 breath every 3 seconds. B. 1 breath every 6 seconds. C. 1 breath every 10 seconds. D. 1 breath every 15 seconds. Answer: B. When an advanced airway is in place, 1 breath should be delivered every 6 seconds without interrupting chest compressions. What is the first step when using an AED on a patient? A. Power on the AED. B. Place the pads on the victim's chest. C. Analyze the heart rhythm. D. Deliver a shock. Answer: A. The first step in using an AED is to turn it on and follow the prompts provided by the device. In infants, which compression technique is recommended when 2 rescuers are available? A. One-handed compression. B. Two-finger technique. C. Heel of one hand. D. Two-thumb encircling hands technique. Answer: D. In two-rescuer infant CPR, the two-thumb encircling hands technique is preferred as it provides more effective chest compressions. What is the maximum interval that should be allowed for a pulse check during CPR? A. 5 seconds. B. 10 seconds. C. 15 seconds. D. 20 seconds. Answer: B. Pulse check should not exceed 10 seconds to minimize interruptions in chest compressions. In a situation involving an infant in cardiac arrest, what is the correct compression to ventilation ratio for 2 rescuer CPR? A. 30:2. B. 15:2. C. 10:2. D. 5:1. Answer, B. The correct compression to ventilation ratio for 2 rescuer CPR in infants is 15 compressions to 2 breaths. During 2 rescuer CPR, which rescuer should activate the emergency response system and retrieve the AED? A. The rescuer providing compressions. B. The rescuer providing ventilations. C. The first rescuer to arrive. D. The second rescuer to arrive. Answer, D. The second rescuer should activate the emergency response system and retrieve the AED, allowing the first rescuer to continue chest compressions. When using a bag mask device for an adult victim, how often should breaths be delivered? A. 1 breath every 3 seconds. B. 1 breath every 5 to 6 seconds. C. 1 breath every 8 seconds. D. 1 breath every 10 seconds. Answer, B. When using a bag mask device, 1 breath should be delivered every 5 to 6 seconds to ensure adequate oxygenation. If an AED does not have pediatric pads, what should be done when treating a child under 8 years old? A. Use adult pads and ensure they do not touch. B. Do not use the AED. C. Use 1 pad and monitor closely. D. Wait for pediatric pads to arrive. Answer, A. If pediatric pads are unavailable, adult pads can be used as long as they do not overlap. What is the appropriate depth of chest compressions for an adult during CPR? A. 1 to 1.5 inches. B. At least 2 inches. C. At least 3 inches. D. 4 inches. Answer, B. Compression should be at least 2 inches deep to provide effective circulation during adult CPR. What is the key advantage of the 2-thumb encircling hands technique in infant CPR? A. Easier to deliver breaths. B. Ensures consistent compression depth and force. C. Easier to switch rescuers. D. Prevents chest recoil. Answer, B. The 2-thumb encircling hands technique is preferred because it ensures consistent compression depth and force during infant CPR. For a child with a pulse but inadequate breathing, how often should rescue breaths be delivered? A. 1 breath every 3 to 5 seconds. B. 1 breath every 5 to 6 seconds. C. 1 breath every 10 seconds. D. 1 breath every 15 seconds. Answer, A. Rescue breaths should be delivered at a rate of 1 breath every 3 to 5 seconds to a child with a pulse but inadequate breathing. If an infant is choking and becomes unresponsive, what should the rescuer do? A. Deliver abdominal thrusts. B. Begin CPR, starting with compressions. C. Attempt to remove the object with your finger. D. Deliver back blows. Answer, B. If an infant becomes unresponsive due to choking, CPR should be initiated immediately, starting with chest compressions. During single rescuer CPR for an infant, what is the recommended compression technique? A. 2-thumb encircling hands. B. 1-handed chest compressions. C. 2-finger chest compressions. D. Heel of 1-hand compressions. Answer, C. For single rescuer CPR on an infant, the 2-finger chest compression technique is recommended. When using an advanced airway during CPR, what is the correct ventilation rate for adults? A. 1 breath every 3 seconds. B. 1 breath every 6 seconds. C. 1 breath every 8 seconds. D. 1 breath every 12 seconds. Answer, B. Once an advanced airway is in place, continuous chest compressions are performed, and 1 breath is delivered every 6 seconds. What is the main purpose of defibrillation in cardiac arrest? A. To increase heart rate. B. To reset the heart's electrical system. C. To improve chest compressions. D. To provide oxygen to the heart. Answer B. Defibrillation works by resetting the heart's electrical system, allowing the heart to potentially resume normal rhythm. In two-rescuer infant CPR, how often should the rescuers switch roles? A. Every 5 minutes. B. Every 30 compressions. C. Every 2 minutes or 5 cycles. D. Every 1 minute. Answer C. To prevent fatigue, rescuers should switch roles every 2 minutes or after 5 cycles of compressions and ventilations. What is the recommended rate for delivering chest compressions during high-quality CPR? A. 80 to 100 per minute. B. 90 to 110 per minute. C. 100 to 120 per minute. D. 120 to 140 per minute. Answer C. The recommended rate for chest compressions during CPR is 100 to 120 per minute to maximize effectiveness. During CPR, why is it important to allow complete chest recoil between compressions? A. To allow the heart to refill with blood. B. To minimize the risk of rib fractures. C. To prevent injury to the rescuer. D. To increase compression speed. Answer A. Complete chest recoil allows the heart to refill with blood between compressions, ensuring effective circulation. What should the rescuer do if an adult choking victim becomes unresponsive? A. Perform abdominal thrusts. B. Give rescue breaths. C. Begin CPR, starting with chest compressions. D. Check for a pulse. Answer C. If a choking adult becomes unresponsive, the rescuer should begin CPR immediately, starting with chest compressions. In a scenario where an adult is unresponsive, not breathing, and has no pulse, what is the priority action? A. Activate EMS. B. Deliver rescue breaths. C. Begin chest compressions. D. Use the AED. Answer C. If an adult is unresponsive, not breathing, and has no pulse, starting chest compressions immediately is the priority. What is the appropriate size mask for providing ventilations to a child during CPR? A. Adult. B. Infant. C. Neonatal. D. Child. Answer D. A child-sized mask should be used to provide ventilations to ensure an adequate seal and effective breath delivery. When providing CPR to a pregnant woman, what modification should be made to compressions? A. Use one hand instead of two. B. Increase the depth of compressions. C. Perform compressions slightly higher on the chest. D. Avoid using the AED. Answer C. For pregnant women, compression should be performed slightly higher on the chest to accommodate the uterus. For a victim in cardiac arrest with suspected opioid overdose, what additional treatment can be considered? A. Administer naloxone. B. Deliver abdominal thrusts. C. Check for a pulse every minute. D. Administer epinephrine. Answer A. Naloxone can be administered to reverse the effects of opioid overdose during cardiac arrest.